Hi, everybody. This is Kevin with Garrison Dental Solutions, and you've been standing by here for the world premiere of Dr. J.D. Corey's presentation, Modern Approach to Successful Anterior Composite Restorations. But before I turn it over to him, got a little bit of housekeeping to do. At the end of the course tonight, we're going to send out an email that has the course evaluation and quiz attached to it. But they're electronic. You need to fill them out completely and then hit the submit button. They will come back to us, and when that happens, we will turn around and send you the CE certificate. Now, we've had such a huge response to this course that there's still probably about 60 or 80 registrations that I have not checked into the system yet. So there are just a handful of people that will not get that email tonight. You will get it tomorrow morning, along with a link to the recording will be sent out tomorrow. So I just wanted to make sure, don't panic if you don't get it tonight. We will send another one out tomorrow, and that will make sure to cover everybody, because we've got, about 2,100 people registered. We've got at least 43 different countries that are joining us here this evening. So when I say world premiere, it is in fact a world premiere. So if you are an AGD member, be sure to put your AGD member in the member number in the slot provided, and we'll submit that to the AGD on your behalf. And then at the very end of the course, there's one more slide. Stay all the way through, because you need the course verification code off that slide so that we can show the AGD that you paid attention all the way through. Plus, that code will get you a little discount on our website as well. So without any further ado, I want to go ahead and turn things over to JD, seated right here to my right in the beautiful Garrison Studios in Spring Lake, Michigan.
Awesome. All right. Thanks, Kevin. All right, let's see here. So I'm excited to be here. 40 plus countries is really impressive. That's so cool. So I'm excited to share this stuff with you guys today. A little bit about me. We're going to move pretty quickly here. So I put my email up. If we don't have time to get to everybody's questions or anything like that, feel free to email me. I'll get back to you as soon as I can. This is a photo of me and my family. A little 4-year-old daughter keeps me pretty busy running around at home. For me, I graduated from Baylor College of Dentistry. It's now Texas A&M College of Dentistry. I stayed there and did an AGD residency, general dentistry residency, which I think was one of the smartest moves I ever made in terms of my professional career. Really set me off kind of down the right path, and that's led me here to practicing as a general dentist in West Michigan. And one thing that's a little bit unique about me, I guess, is that I test a lot of products and prototypes. I don't get compensated to do that. It's just something I really enjoy, love doing. I think it started 4 or 5 years ago that I started working with a few different companies, and since then it's grown to where these companies will send me their products, their ideas, their prototypes, and I'll sit down, evaluate them, give them feedback, video and analysis and everything else, so that I can help them make these products better, so that we can do better dentistry. And I came across this meme that really kind of sums up my relationship with these companies. They have this great, they develop these products. They think they're going to be the answer to, all the problems that we face. And then I come in and I take these products through the ringer. I mean, I test them out with patients who they can't open, there's saliva, there's blood. I mean, just normal real world conditions for us dentists. And the products don't always perform like the companies want them to or expect them to, but sometimes they do. And so there's been several products recently and some really exciting stuff that's coming out soon that's, I'm excited for, and I'm excited to talk to you a little bit about some of those newer products today. Why anterior composites? Today we're going to focus on anterior composites, and there's really 3 main reasons why I wanted to put together this presentation for you guys. One is just the huge challenge of doing these fillings. We have challenges anytime we do fillings anywhere, keeping a marginal seal and just making sure our restoration is sound. But one of the things that makes this very challenging when we're doing fillings on anterior teeth, as you guys know, is the aesthetic component to that we don't necessarily always have to deal with when we're doing posterior restorations. And if you're like me, it's not like we're scheduling more time to accomplish these restorations. We're not getting paid more to do these restorations. They're just part of our everyday workflow. And, you know, we want to do the best job we can so that we get great results for our patients, but they can be really challenging and frustrating. And thankfully, there are some new and exciting developments that have come about that are really going to help do high quality work in less time, just help us be more efficient and help us achieve really good quality restorations. And then finally, I wanted to expand a little bit on the scope of the current CE when it comes to anterior composites. You know, what the focus should be on is doing high quality work in an everyday situation where we're really accomplishing all of our goals. But unfortunately, a lot of the CE that's available and that's out there is geared towards a smaller percentage of the dentistry that we do, like diastema closures and you know, shade mapping, layering, composites, things like that. Those things are very important, but it's not necessarily something that we run into on an everyday basis. If I had to guess, I would say that most of you guys aren't necessarily struggling with matching the shade of the composites. The composites today have gotten so good that that's become easier, but you know, where the struggle is, you know, we don't want our patients to come back a year later or 6 months later and have the filling we just did, you know, stained and breaking down. So we're going to talk a little bit about why those composites fail and how to prevent the failure. So let's look at, you know, the top 5 reasons based on this systematic review here, why these restorations will fail. And number 1 is secondary decay. We see this a lot with restorations. We're going to touch on each of these in a little bit more detail. Aesthetic concerns. This is the huge challenge for anterior restorations. Things like shape, stain, color, matching, all of that. We want to be perfect for our patients. Fracture, loss, or retention is another big one. You know, especially with patients who clench or grind or have a deep bite. These are all big time challenges for us to overcome with these anterior restorations. Open contacts can cause a lot of problems. And then of course, post-operative sensitivity we run into as well with any filling. So before I get into kind of how we can overcome these challenges, I want to say that what we're going to focus on here is more related to the factors that we can control. Obviously, there's going to be patients with just terrible oral hygiene, and that can cause a lot of these things, a lot of these restorations we do to fail. But I want to focus specifically on what we can control. The other thing I want to mention is we're not going to spend a whole lot of time talking about, you know, bonding protocols and curing protocols and all of that. I just, you know, there's so many different types of bond out there that, you know, basically follow your manufacturer's recommendations there and you should be safe. But those are very important steps as we're restoring these teeth that we want to take. So what we are going to look at is what's in our control outside of those protocols. And the biggest one, the most important, in my opinion, is maintaining a good marginal seal for your restoration. And some of that has to do with how well you can get the matrix to adapt to the tooth. If there's a gap between your matrix and the tooth, that's going to lead to problems like secondary caries with your restoration. So that's a huge key, is making sure that your marginal seal of your restoration and as well as your matrix seal are perfect. And then keeping the area isolated. I'm not the type of guy who's gonna sit here and lecture anybody on whether they use a rubber dam or not. It's just important to be conscious of keeping the area that you're working free of any kind of contamination, especially, you know, saliva, blood, crevicular fluid, all of that. We constantly have to keep that in mind because that will definitely cause our margin to break down, our restoration to break down, and can lead to decay. Creating a hygienic restoration is key. That can cause problems as well. When we're looking at the aesthetic component of why these restorations fail, this is really the majority of I don't want to say the majority of the failures, but a lot of things come into play here. Again, we want to do the same things we just talked about, keeping everything isolated so our bond doesn't break down, maintaining that marginal seal, creating that hygienic restoration are all going to be important to prevent things like stain and breakdown of the restoration. We also want to consider our prep design and how that's going to impact the way the shade blends into the tooth and the potential staining that could occur. I hope we have some time to get into the prep design a little bit more. I think we will, but that's a very important key. We also want to match the shade of the tooth. Composites have gotten so much better that that's becoming easier and easier on most patients. There are some patients who it's just extremely difficult. And you know, it's also very patient specific. I tell my assistants all the time that every tooth is different. And if you get a tooth with a lot of character in it, you know, just making it all look like one shade is not necessarily going to cut it. But, you know, there's a lot of factors that go into that. And I hope that we can touch on that as much as we can in terms of blending that shade in, using the appropriate restorative technique. It's not that I want to make sure that I make this very clear. There's no one best technique for every situation. And even, you know, a technique that may work best for me may not work best for you. So it's what works best in your hands. But the thing I would suggest here is don't be afraid to, you know, get outside the box, try new things, try new types of matrix systems, new restorative techniques, see if you can get better results than what you're currently getting. There's some dentists out there who they learn one way in dental school and that's what they stick to. And I would recommend that, you know, maybe trying new things could help you progress, help you achieve better results. Making the contour symmetric and anatomically correct. This is where the artistry comes in within dentistry. And we want to make sure we nail this for our patients so that we don't have these, you know, aesthetic failures when it comes to doing these anterior restorations. And then using proper finishing and polishing protocols. I think one thing that gets overlooked is texture. That's very important. If your patient has a porcelain crown next to the tooth you're working on, you know, everything might look perfectly smooth. But if they have a natural tooth with some texture in it, if you make the tooth you're working on look completely smooth, it may not blend in as well. So you just want to be conscious of the texture and the way that you're blending that in. Unfortunately, I don't think we're gonna have too much time left over to talk about creating that texture, but we'll kind of see how we're doing on time for that component. Fracture or loss of retention. This is really frustrating. When you do a filling on a patient and they come in a month later and it's already chipped out, we obviously want to avoid this when we do these anterior fillings. Some of the things that we can focus on is having a really good marginal seal, having a really good seal as you're restoring the tooth with your matrix band. Those things are going to help prevent that restoration from breaking down. You know, improving the prep design. I will say that I'm a fan of beveling larger than most, not necessarily deeper, but just more wider bevel than what's common. I think that it helps me achieve a better bond, it helps me blend in composites quite a bit better. Obviously, occlusal considerations play a big role in this as well. If you're, you know, patients grinding their teeth or they're have a really deep bite and they got a really thin incisal edge and we're trying to replace a small corner, that's difficult. We need to have those conversations with our patient about what treatment is best and what to expect when we do these restorations. Open interproximal contacts. We obviously want to avoid this. The appropriate restorative technique, the one restorative technique here that I see gets some dentists into trouble is when they use a flexible system and they wrap that, you know, band or strip around the tooth. If you're not careful using the right technique, it could pull that composite away from the adjacent tooth and leave you with an open contact. So we definitely want to avoid doing that. You could consider using, you know, a larger wedge, consider pre-wedging. I pre-wedge probably 90% of my restorations in the posterior, in the anterior as well. I like to pre-wedge when I can. You could consider using a thinner matrix band. that'll help you just achieve tight contacts. And then post-operative sensitivity. Sometimes we can't avoid it, if you have a situation like this, but other times, this is where we really want to make sure that our bonding protocols and curing protocols and all that stuff are spot on. But, we also want to have a really good seal at our margin so that we're not getting any kind of leakage, and that doesn't cause sensitivity there. But again, sometimes it's just not avoidable. All right, so we're going to look at this in phases, as we prep, restore, and finish the tooth. And when I say prep, I don't necessarily just mean, cut the teeth. That's not really what I'm referring to there. I'm talking about preparing to do the restoration. There's a lot that goes into that for these anterior teeth. We're going to touch on that quickly here. You should have, even if it's just in your head, some sort of pre-prep checklist where you're really going over the informed consent. You're talking about your occlusal considerations. You're talking about aesthetic outcomes, prognosis. What are the patient's expectations in this situation? What's the likely outcome that you think you can achieve? Do those match up? I'll give you an example here. If you have to do a restoration on a patient where they have maybe some crowding on the mandibular anterior teeth, and you've talked to the patient that a crown would be a better option, but they can't afford to do a crown. You could cover some alternatives at the time, including maybe reducing that mandibular anterior tooth a little bit to create a little bit of extra space for you to thicken up that restoration. Obviously, it's not something we want to do, but the time to have that conversation is before you work on that tooth, not as you're adjusting occlusion or anything like that. So that's just important things to remember, just a refresher. We want to work on clean teeth, that's important. We should select our shade before we numb, before we isolate, and then the isolation, we want to make sure we're keeping a close eye on that. Bevel design, again, plays a huge role in your final outcome. So you want to definitely begin with the end in mind when it comes to the design of your prep. The restorative is really where we're going to focus more of our attention to today, choosing the best materials and restorative technique. And I'm not necessarily talking about materials as in what bond you're using or what composite you're using. I'm talking about, the matrix system too, because that's going to play a big role in what you're able to accomplish and the end result. That's going to, play a big role in your marginal seal, your matrix, everything. Your technique is very, very important when it comes to these restorations. But we do want to focus on, maintaining that marginal seal, creating tight interproximal contacts, matching your emergence profile, your contour, especially interproximally. And this is really important. The interproximal contact is what we're after here during this phase of the treatment. We can finish the facial surface relatively easily. We can get any burr or disc we want in there on the facial surface, on the lingual surface. But when it comes to restore or finishing the interproximal surface, it becomes very difficult. It's hard to get a burr in there. We don't want to, create a kind of ditched area interproximally. It's difficult to shape that the way we want to during the finishing step. So if we can do that as we're restoring the tooth and then just have to worry about the facial and the lingual surface, that's always ideal in my opinion. So I try to pay really close attention to the restorative contour interproximally, knowing that that's the most difficult spot to reach when we're trying to finish that. And then we want to, choose the right shades and the right technique for your shade. And if the tooth has translucency, we want to make sure that we're considering all of those things. As far as finishing, this is where we're going to make everything perfect. We're going to match the contour, match the texture like we talked about earlier, smooth and polish. I think sometimes what happens, and I'm guilty of this, is, it's so difficult to do that restorative step where we're really trying to place that matrix system where it needs to be and have everything contoured really well that we kind of run out of time to add in texture, smooth and polish. And we don't want to have to rush through any part of the restoration. So just making sure we have enough time to really do a good job making sure everything's smooth, everything's polished, there's no little ledge or overhang or anything like that. We create that nice hygienic restoration. And then one tip I can give you guys is following up with your patients, at their next hygiene exam or their next visit. If you have burrs or whatever you need, handpiece out already, to be able to quickly adjust a filling, I think your patients are going to really appreciate that. If they come in and they have a little bit of stain on an anterior tooth, if you could just take 5 seconds and get rid of that stain for them and polish that back up, they're really going to appreciate that, and it will help extend the life of these restorations. If you have to go out and get everything, or have your hygienist go get everything to do that, then it's a little bit more cumbersome, takes a little bit of time. But I like to have things out at their hygiene recall visit, so that I can touch up any restorations if I need to very quickly. And again, I think the patients really appreciate that. So again, we're gonna focus the rest of this presentation more on restoring these techniques, that restorative phase, our matrix systems, our techniques that we can use. We're gonna look at what tools are available to help us really have successful results with these restorations. And the first one we'll start off by is the Mylar matrix strip. Everybody knows the Mylar matrix. It's been taught in dental schools all over the world. It's still being taught in dental schools as the go-to technique in a lot of places, and for good reason. It's inexpensive and it's easy to use. There are some disadvantages. It's a flexible system, like a lot of systems are, and the downside of that is, as you're injecting composite or condensing composite up against that matrix, it's going to cause the matrix to move. Regardless of your wedge, regardless of how much finger pressure you're putting on that matrix band, it's just by nature flexible, and it's going to cause some distortion, and that can pull that matrix band, if you're not really careful, away from the tooth and open up that seal between your margin and or between your tooth and your matrix, and cause other problems. So that's something we have to be really careful about. The other thing is, as you're wrapping that band around the tooth, you got to be careful. If you pull a little too hard, you can end up with an open contact. If you don't pull hard enough, then you risk not shaping that restoration just like you want to, or not compressing that composite where it needs to be. So it's a little bit technique sensitive. It also doesn't have any built-in curvature. We kind of have to do that ourselves, which can be a little bit of a hassle. It's just not very customizable. So thankfully, there are some other products. This is the Very Strip. I like this product. This is something that I've used in the past. It has, you use it the exact same way as you use a clear strip, really. The difference is it does have built-in curvature to it. It's got curvature both from like a facial lingual dimension and from a incisal gingival direction. And it's also variable in height. So it starts off, it's tapered, and you can match the height of the tooth up with the height of the strip so that you get the proper curvature for the tooth that you're working on. And I really like that feature a lot. It's also blue, which is not a huge deal, but I like that I can see it. Sometimes those clear strips can get lost a little bit. So, otherwise it's got the same disadvantages as the clear strip. It's flexible and it's technique sensitive for the exact same reasons. We're going to take a look at BioClear, which is another great product that's out there. There's some dentists out there who do incredible work with this system. It's got built-in curvature. It's got a lot of different sizes, so it's pretty customizable. Fantastic product for diastema closures. It really helps to kind of rebuild the contour of the side of the tooth. The disadvantages here, it's just a bigger learning curve, and it's technique sensitive because of that learning curve. I've tried really hard to incorporate this product into my everyday workflow. I still use it for certain situations like diastema closures, but I haven't really been able to master it enough to where I feel good about using it in normal everyday dentistry situations. It just takes up a little bit more time, and I don't get the same kind of results as I do with other products. So for me, it's a little bit difficult and cumbersome to use, but this, if you haven't tried this, maybe give it a try and see how well it works in your hands, because like I said, I've seen some dentists do some incredible work with this product. A lot of people have been doing this. A lot of dentists out there can relate to this. They take posterior matrix bands and they're using them on anterior teeth. And I think a lot of that is because these matrix bands have a great built-in curvature and they're more rigid. So you don't get that same kind of deformation of the band as you're injecting the composite. And there's really two ways, we'll talk more about this in a little bit, but there's two ways that you can use this this concept of posterior matrix bands. You can use like an extra tall band and use it upright, or you can use it, you know, flip it 90 degrees and use it where it's kind of laying on its side, I guess, and I'll show you guys an example of that later. But this technique does a really good job of matching the interproximal curvature that you want. It is technique sensitive because it really only helps you to restore that interproximal surface of the tooth. You don't really get the facial or the lingual surface very much. But again, the important thing is the interproximal surface. So at least it's helping with that. And this, you know, if you haven't tried this, this is maybe something you want to try in certain situations, because it's a nice tool to have in your toolbox to kind of manage certain complications when they come up. We're going to look at the Garrison Blue View cervical matrix. This is one of my favorite products. I love this product. It creates a great seal of the matrix to the tooth structure. It comes in 7 different sizes so that you can get a really good fit. Built-in curvature that matches the tooth really well. It's easy to use. One of my favorite features about this is it compresses the composite up against the tooth. And what happens when you do that is it really gets rid of any little voids, and you end up with just a really nice smooth surface. Even when you go to polish that surface or finish that surface, everything just turns out just glassy smooth because you're compressing that composite. I think for me, what happens when I try to freehand these restorations is, you know, just by pressing a flat instrument up against the tooth, if you're not careful, you can kind of fold that composite onto itself and create little voids. And as you're polishing that composite, you know, that you just keep uncovering more and more voids, which is not what we want. So I really like this product for that reason. I felt like I had to put a con in there for this product, but I really couldn't think of much. They're single use, so that's about it for this product. I love using these when I can. This is another similar stamp type system called the U-Veneer, and this is a fantastic product for certain situations as well. Creates just a great tooth shape on that facial surface. It's really nice. You can autoclave these. They're reusable. They come in multiple sizes to help you match, you know, the size of the tooth that you're working on. My favorite feature, one of my favorite features here is that it has built-in texture, and I'm talking like it just looks so, you know, excellent, realistic. I think the second generation is the one that has the built-in texture. It's pretty easy to use. The disadvantages are they're just limited scenarios where this product is applicable, I guess you could say, unless you're restoring the whole facial surface. It's not something that's necessarily ideal. And even if you are restoring the whole facial surface, if there's any kind of class 3 incorporated with that, it gets a little bit challenging. You almost have to restore that first, then come back over top with this, which is not a bad thing. But you know, it's not necessarily something that I would say is practical for everyday dentistry. It also reminds me, I did not include a putty matrix in here because I just don't think it's practical for an everyday dentistry standpoint. But that's definitely something that can be very useful if you do have a little bit of heads up ahead of time that you're going to do a larger restoration, a class 4, and you can have a putty made that can, you know, come in handy and help you achieve really good results as well. This Unica matrix, I think I'm pronouncing that correctly, is another newer product that is pretty unique, does really well to help you restore teeth that have class 3 and class 5 combination restorations. It's got this part that covers the cervical area, the class 5 restoration area, and it also has these wings that come up and help you restore the interproximal contact. You can do on the same tooth mesial and distal simultaneously, which is really nice. It's got that nice built-in curvature. It's ultra thin. It's like half the size of a clear strip, which is incredible for getting those tight contacts that we want. You can use it in a lot of different ways. The negatives are it's difficult to get in place where you want it to be, and even then it wants to move on you a little bit sometimes. You know, it's technique sensitive is what I would say. The marginal seal, the seal of the matrix to the tooth, isn't always perfect. So unless your isolation technique is great, this may not be a product that works really well. But if you have really nice, perfect isolation, then this could help you save a significant amount of time on your workflow. And but it does have that learning curve. If you're willing to dedicate the time to work on this product, learn how to use it, you could end up just really streamlining these difficult restorations and getting excellent results. This is one of the newest matrix systems on the market. This is the Garrison Fusion anterior matrix system, and this is an excellent product as well. The thing I like, one of my favorite features about this is you can actually stack these together similar to the way we can stack posterior matrix bands together. We can treat mesial and distal restoration simultaneously, which is a huge benefit. It has built-in curvature that matches the teeth really well. It's ultra thin again, which helps with the contacts. Easy to place, easy to use. Unique curved wedges help to really tuck that matrix band up against the tooth. The disadvantages here are, it only comes in 2 sizes as of now. Really, each of these is tapered. So, really it's probably more like 4 sizes depending on which direction you use it in. But I'm hoping and hinting a little bit that maybe there'll be some additional sizes for those very, very specific types of restorations. But I think that the sizes that they have come up with for these matrix systems work in the large majority of cases. So those are really cool. I'm going to show you a case where I use those the Fusion anterior matrix system here. And this is, class 3, class 5 combination restoration, where essentially you have the class 3s, you have the class 5. This was actually an ortho patient with, the bracket square, decalcification. So we end up beveling the whole facial surface there and incorporating that class 5. And so this is a challenging restoration, but here I have these matrix bands in place. What I'm going to do here is I'm going to restore each class 3 here. So I'm just going to add composite to those boxes. And then I'm going to take the Blue View cervical matrix band and press that up against the tooth, leaving those matrix bands in place to help guide that cervical matrix, right into where it needs to be, and compress that composite. And then I'm going to add a little bit of composite to that facial surface, and we're going to end up with a really nice restoration. And now you can do this with a clear strip, with a blue strip, with any other system. But for me personally, this took me less than half the time to accomplish as if I would have done it with the Vari strip or the clear strip. And I get my results are even better with this system than they have been in the past. So this really helped me streamline the restorative process. We're going to look at stacking those bands as well. You can see here a couple things I want to talk about with this slide. That the matrix system, everything's in place. And what I like about this is, historically what I would do is I would put my matrix band in, put my wedge in, if I was using a clear strip or a blue strip. The flexible systems, I would put that in, put my wedge in, and then I would restore one of the teeth. And I would take the wedge out and make sure there's no bleeding or anything like that that would, compromise my restoration, which can be a little bit of a hassle. And then I would do the same thing for the other tooth. Now in this case, I have everything set and ready to go, and it just takes a lot of the hassle and the time out of, restoring a situation like this. The other thing I want to mention is you could see the contact point that I have set. that's fully customizable depending on which orientation you put these bands in. The other thing that's really nice is if you want that contact point to sit a little lower, all you do is you just push those bands down a little farther into the sulcus, and because they're so rigid and they just slip right into that sulcus, and they're not going to deform on you if you push them down even with a little bit of force. So that's really nice, and we can customize the location of that contact point pretty easily with this system. The last thing I want to mention is, a common misconception with people who are new to this system is that you want the band almost like a right angle where it sticks out in a similar orientation to where that blue wedge is. And I'll go over this more here in a minute, but what you really want is as the band curves around the tooth, you want the part that's sticking out towards your restoration to follow the tooth, the line angle of the tooth. Really, you want that band to curve around the tooth, and that's going to help you, maintain that marginal seal of that matrix band, the seal of the matrix band up against the tooth, to help you limit how much actual finishing and polishing you have to do. And this is that, situation fully restored. What I'll do here is I'll restore one, I'll take the band out just to limit the thickness that I'm trying to overcome with the matrix bands, and then I'll restore the other one, but I don't remove the wedge. I'll leave the matrix band, I'll leave the wedge in place even as I pull that first matrix band out, and that's the final result we get. Now, this is the last case I'm going to show you before we do a little bit more hands-on stuff. This is what I would consider everyday dentistry for me. Patient walks into the office and they have this overhang on number 10, and that overhang's caused all kinds of problems for number 10. That composite's breaking down. It's also caused decay on the distal of number 9. And so I'm going to fix that situation here. And this is, kind of a prep that subgingival on both teeth. Difficult situation. These matrix bands, the thing that was a struggle with the flexible systems, anytime you were subgingival, was, it's not like you can just push those flexible systems down. They any force you put on them, they just, will distort on you. And that's not the case with these. So I can push these down, tuck them in right up against the tooth into the sulcus, stack both of these at the same time, and restore these just like I showed you in the last slide there. And this is the final result that we get. And you can see that emergence profile in the radiograph there, the way that composite blends into the tooth, that's what we're after. And that's going to lead to a more successful result. And that's a difficult situation, again, that we run into on at least a weekly basis, if not a daily basis. So definitely, these types of systems, are the rigid systems is what I would call them, are helping me to gain better results. We're going to go, a little bit of a hands-on demonstration here. We have a typodont here, and we're going to kind of walk through a couple different scenarios. We'll start off with just, your standard everyday class 3 restoration. And with something like this, there's no need to get really fancy here. You could use one of the newer systems. In this situation, what I like is, one of these Vari-strips. You could see how what I was referring to earlier, they're tapered, so they're thicker at one end, thinner on the other end. They have the curvature this way. They also have the curvature this way here. And so, what I'll do in this situation is I will put that matrix band between the teeth, and then I want the height of that matrix band to match the height of the tooth, not the height of the restoration. So I'm going to pull that until that contour matches. That's going to help me get the best possible curvature to that restoration. And then the key with these is very firm finger pressure on one end. That way we don't get as much distortion. And we're going to fold that band over to help blend that in. I know that you guys don't need a whole lot of a whole lot of, you know, show and tell with this, because everybody's pretty familiar with how to use these strip type systems. But essentially I'll go ahead and I'll fill this. You know, typically I guess I would put a wedge in here. In terms of where you wedge from, we lost our screen here for a second. In terms of where you wedge from, it's really a matter of the embrasure spaces. So if you look down, you know, at the embrasures of the tooth, if I was going to place a wedge here, this embrasure is larger than the embrasure here. So this is a bigger triangle than this triangle. And if we look at our wedges, you know, we can see one side of the wedge is thicker and one's thinner. We want to match those up so that, you know, we maximize our wedges capability to you know, apply pressure up against that tooth. And so I will tuck that matrix band into place first, apply that wedge, and then again, put finger pressure there, a lot of pressure, inject some composite there. I'm gonna have Kevin do double duty as my assistant. If I have any excess, I'm going to kind of clean that up. So that it's just less to finish and polish. And then I'm going to take this matrix band and I'm going to curve it, try to match the curvature of the tooth. Yep. And then we're going to take that out. And then we end up with a nice result there. A little bit of extra on the facial. And that's kind of what I was talking about with these flexible systems is, you know, we don't get that perfect seal of the matrix band up against the tooth always. And how we wrap that around the tooth really plays a big role. So I would give myself a pretty good grade when it comes to how I wrapped it around the tooth and compressed that matrix band in the gingival part, but I had a little bit of excess up in, you know, the incisal part of that prep. And I don't like that because that's going to take me longer to finish. It's going to be more difficult to finish. But that results from the way that I wrap that band around the tooth, and I didn't have the angle correct to really wrap that, you know, as kind of tuck that into place right where it needed to be. So that's kind of one of the risks we run with these flexible systems. I'm going to show you another class 3 that I'm going to do with one of the newer systems, and we'll go ahead and look at you know, this kind of combination where you have two preps that are next to each other. One is, you know, distal facial lingual, the other one's a mesiofacial. And in that situation, we got a lot of different techniques we can go to. Let me show you an example of, you know, this posterior system, the way I would use that. I prefer stiffer bands. You have some bands, you know, they're called like dead soft. I prefer the stiffer bands because they don't flex as easily. I could put more pressure, break contacts, no problem, and they're not going to deform on me. So that's what I have here is a stiffer band. And I'm going to tuck that into place and just kind of tuck that down into the sulcus. So I could restore that tooth like that. And, you know, that's going to lead to a pretty good result there. It matches the curvature of that tooth pretty well. In the past, I used to do that because I wanted to get that curvature. I didn't want to have problems with that curvature. Now, after the fusion system came out, not so much, just because I could do both of these at the same time using these fusion bands. So this is what they look like. Here you got this wedge or this curved shape band, and it's got just a unique shape. You can see it's tapered, it's thinner on one end, thicker on the other end. I like to place the thicker end towards the restoration. So when the restoration is right in the middle of the tooth, you can do it either way. You're going to get the same results. If the restoration, you know, if you're closer to being subgingival, I like to place the thicker portion towards the gingiva. If it's closer to the incisal edge, like a class 4, I like to flip it around. So what you can do in these situations is, you know, you're going to place that matrix band down into the sulcus, and you end up with something that looks like this. And now, because these are right next to each other, what I'm going to do is I'm going to take that matrix band, another matrix band, exact same matrix band, and put another one in, and we're going to tuck that in to the adjacent tooth, just like that.
Ever get caught on the prep when you're doing that at all? Or
It's
they slide in pretty easily?
it's thick enough to where, or it's stiff enough to, rigid enough to where I can push right through that if it's getting
Okay.
caught. I haven't had any problems getting them through, even if I don't break contact, getting them through. So that's what we end up with here. And in this situation, I'm going to put a wedge in. And again, I'm going to wedge from the lingual here, kind of hold that down, get that wedge in there. And then what I like to do with these is I'm going to put composite in. And then what I'm going to do is what I like to call, I'm going to set my line angle. So there's two different ways that you can restore these. You can inject the composite, take a thin instrument like this, and kind of scoop the composite towards the facial surface. That's one way to do it, and that works pretty well. What I don't like about that is it leaves it can leave an irregular, you know, line angle when you do that. What I like to do is called set my line angle, which is where I'm going to take an instrument, a flat instrument, and I'm just going to slightly fold this to match my line angle. And when I do that, that's when I'm going to have my assistant cure that restoration, and we're going to end up having to finish very little. You know, the finishing that we're going to do is going to be on that facial surface. So that's kind of what I'm going to do. I'm going to inject the composite here. And then I can remove a little bit of excess if I have it. And then what I'm going to do is set that line angle like I talked about. And then I'm going to have Kevin cure this for me. All right.
I'm the wiggliest cure you'll ever
That's
see.
good. Okay. And so then what we're going to do is we're going to remove just that one matrix band. We're going to leave the other one in place, and you can see that that contour is pretty spot on with where we want it to be. Really happy with that. And then we would do the exact same thing for this restoration here. The other thing we could do, I think I, you know, showed that in a clip, is if we had a class 5 combination with this, we can use this tool. This is the Blue View cervical matrix stamp. We can use that to you know, kind of just, it guides right up against that. See if I can find the angle to show you guys. Guides right up against that matrix band, and we can press that down, compress that composite, end up with a really nice result, and just kind of use that as a guide. So that's just a great way to restore these types of restorations. Really nice curvature there. Everything just comes out where I don't have to do a lot to the interproximal. Facial, you know, I've got a little bit of excess right on the facial, but not on the interproximal surface. My line angle is set. That looks really good. So, you know, I'm happy with that. I'm gonna jump to, let's see, how are we doing on time here?
About 10.
Yeah, I'm gonna jump to, we'll do this class 5 here, because I want to show you guys, you know, in this situation, flip these around so we can get a better angle. So in this situation, just a normal class 5, let's say hypothetically that we had a class 3 to go along with that, and you wanted, you know, an alternative to using the fusion system with, you know, the Blue View cervical matrix. what you could do is use this. This is that Unica matrix. And the way that we can use these is essentially tuck it into the contact. Now we're saying if there was a hypothetical, you know, a class 3 here, a little bit of trouble breaking that contact there. So what I'm going to do is just put a little wedge in to help me open that contact just a bit. There we go. I'm going to take that wedge out now. Okay, so we're going to wrap that around the tooth, and then we're going to tuck that in to where it needs to be, just like that. And so you can see now that matrix band is up against that class 5. And I still have access to the class 5. You know, some of the other systems that are similar, it's got a higher ridge right here, and that can lead to just, it gets in the way. You end up with a really bulky facial restoration. And if there was a class 3 here, you have a semi-rigid, you know, matrix to condense against. A couple wedges will keep that stable. But you know, my favorite way to use these class to restore these class 5s are, I just want to spend just a minute on explaining the technique for using these, you know, to restore a class 5. So we picked one that the shape fits really pretty well. The way that I like to use these is not by injecting composite, you know, onto that surface and then using this to press it down. We could do that, but what ends up happening is, you know, we lose our seal of our matrix band up against the tooth. We don't want that. We want that seal of the matrix up against the tooth. So what I will do, that's the most important thing to me, is that I keep that seal of the band up against the tooth. So what I will do is I will put that matrix band right where I need it to be. And then I'll have my assistant inject some composite, you know, and this is a little learning curve for them too, but I'll have them inject some composite, so that's good, right into that spot. And I will make sure that I'm not moving off of that seal that I have. And then what I'll do is I'll roll this towards the facial, and then I'll have my assistant, before you cure that, get rid of the excess.
Okay.
So just kind of scoop away that excess for me, and I'm holding firm pressure so that nothing's getting in the way, and then I'm going to have them cure that. And we end up with just a nice glassy smooth surface to this restoration that, even if we polish it and finish it, is a very good result.
I think I didn't have it in the right spot.
That's all right. We had a curing issue to the plastic tooth, but I'm not worried about that. No bond or anything. So, you know, that's all I have time to cover with you guys today. We are doing a 3-hour hands-on course where I'm going to go into a lot more detail on, you know, how to use some of these products and you know, how to overcome very specific challenges that we face with these restorations. But I just wanted to give you guys more of an overview of the options that are out there besides a clear strip. We can open it up if anybody has questions for a few minutes.
Just to mention about that course that we have coming up, I think it's July 23rd, isn't it? Friday, July 23rd from 11 a.m. to 2 p.m. Eastern time. And you will be receiving an invitation to that event. Seating is, you know, we're going to do a web based presentation like this, but you'll have all the materials, including a Type-A-Knot, all the matrix materials. Composite, I think we're being provided by 3M. So you'll get a full kit of materials and you'll work along with us. So that's coming up. Keep an eye out for invitations in your email. All right, Kendall, do we have some questions that have come in?
Yeah, sorry, Kevin, I didn't catch if you told everyone that that's for US customers.
Oh yeah, no, I didn't say that. I should say that. With all the people from Sri Lanka to Sarajevo, Yeah, that hands-on course is for US customers only. Apologize for that.
Okay, first question is, do you recommend mouth guards to eliminate potential fractures?
I think that would be ideal if every patient we did, a class 4 filling on would wear a night guard every night. It's just not realistic. So in certain situations, I will highly recommend it because the patient doesn't want that restoration to fail. I don't want that restoration to fail. But, it's not something that's I make mandatory by any means or anything like that. I just do my best to educate the patient on why it's important and what can happen if they don't wear it, and that there are alternatives in some situations, crowns and different things that we may end up having to go to, if it's just a really challenging situation.
With the side-by-side restoration example that you showed on the Type It On, how are you isolating to not have contamination in your prep?
Sure. I think we showed like a couple of the case presentations there. If my preps are, closer to the incisal edge, that's obviously a much easier situation to isolate. If my preps are going to be more towards the gingiva, then that's obviously more difficult. I'd like to place a rubber dam when I can. I think that really helps if the rubber dam's placed correctly. But what I found is really the most important thing is getting the compression of the wedge on that tissue to help stop, any kind of bleeding or any kind of fluid from coming up. In combination with the rubber dam, those two things are extremely beneficial.
Could you explain what you mean by pre-wedging?
Pre-wedging, sure. Yeah, so pre-wedging just simply means, put a wedge in even before you prep. Sorry, I did not explain that. That's a good question. I will put a wedge in as the very, after shade selection and all that's done, numbing, I will put a wedge in as soon as I can, because the longer that wedge sits in there, it just wedges those teeth apart for a longer period of time and makes it easier to achieve a tight contact. It also gives me a very good boundary of, there's 10 different reasons why I like to pre-wedge, but it gives me just a great boundary of how deep my wedge can go before that restoration gets to be below the level of the wedge. And that introduces a whole new level of complexity. So it just gives me an idea of, how much room do I have before, the restoration goes even deeper than what my wedge can handle.
You'll like this question, Dr. Corey. Do you bevel the margins of your class 3 preps?
Yes, I do bevel the margin of the class 3 preps pretty significantly. I'm a fan of what I like to call the plastic surgeon bevel, which basically utilizes landmarks in the tooth to hide your bevel. So for example, line angles, CEJs, I'm not a fan of deep bevels. I'm not talking about anything into the dentin by any means, but prepping or beveling the enamel, very wide bevels, hiding them behind facial lobes, incisal edges. These are all things where I try to take my bevel to help hide them, and you just get better blend in your color. You get a better bond. There's a lot of reasons why I do like to bevel those.
Yeah, we shot a video in preparation for the hands-on course where you were showing the people who are going to attend how to prep their Type It On.
Sure.
When they get their Type It On, they're to watch this video, and you go through, quite a bit of detail on landmarks and all that good stuff. So, if you're able to, yeah, join us for the hands-on course, because then that's included in there. Some good instruction on that.
What occlusal checks do you carry out at the end of anterior composites to reduce risk of chipping?
Sure. What I like to do is actually check my occlusion before I prep the tooth. I didn't get to include that in the presentation, but I do check the occlusion before I prep the tooth, and then I try to pretty much, duplicate that as I'm restoring the tooth. I don't always think it's necessary to completely take your restoration out of occlusion, but patients need to understand that, when you do a composite on a tooth, it's not as strong as your natural tooth. It's never going to be as strong as what was there previously. So, in some way, that situation is compromised. And I'm personally relieved when a patient comes in and told me they bit down on fishing line and they broke a piece of the tooth. I would rather have that, because I could tell them don't do that anymore, than have somebody who broke their tooth because they were grinding at night. That's a situation where it's going to be much more complicated. And we can't always have just nice straight incisal edges. And I mean, we have to think about reproducing the wear patterns that they have, which is compromised aesthetics in some cases. And so a lot of that, yes, we're checking occlusion at the end, but a lot of those considerations happen and discussions with the patients happen before we even prep the tooth. And I check it at the beginning, because the last thing I want is to build up this beautiful, class 4 that looks excellent, and then end up having to adjust it all away because it just doesn't match up with the patient's occlusion. We'll occasionally talk about doing, aligners to correct that, or putting them in crowns, but sometimes patients just can't afford that, and we have to be respectful of their anatomy, and kind of blending what we're doing in a functional way, even though it's an aesthetic situation, matching the functions of the teeth as well.
We do have more questions, but there are a lot of folks asking about the code. Kevin, could you please put the code on the screen?
There we go. So yeah, that's the code you need for tonight's course, WB621A. And you can use that also on the Garrison website here in the US, direct purchases only for $20 off any purchase, including some of the matrix materials that you saw here tonight. But just kind of a recap, we will send you an evaluation and quiz shortly after we wrap up here. We've got a few more minutes if you're willing to stick around, and Dr. Corey's willing to answer a few more questions. You're welcome to stick around for a little bit, but it's entirely up to you if you would like to do that. But that's the code you need when you get your evaluation and quiz here in a few minutes.
All right, next question is, how are you handling subgingival preps with the anterior matrix system, specifically how you can avoid dark triangles?
Sure. Dark triangles are difficult, and sometimes they're not avoidable. And again, that's a conversation to have ahead of time. But specifically, what I've found is, unless you're when you're trying to create a non-natural closure to a black triangle, some patients, the way that their gums have receded, their tooth shape, they're meant to have black triangles. Their other teeth have black triangles. I'm not necessarily trying to correct that in that situation, but if somebody comes to me and they have a black triangle that they want corrected, that's where the technique comes into play a lot more, and it's a little bit more challenging, and it just totally depends on the shape of the tooth. If I'm really trying to bulk it out, I would consider something like a BioClear. That in my mind is that's where it shines, is really bulking teeth out, even subgingivally. That system does really well for that. The fusion system, like I showed today, doesn't really bulk stuff out in a non-natural way like sometimes we want to accomplish. So, that's a situation where, we prep it if we're trying to create that unnatural contour where we're trying to close down space and really bring that restoration out towards the other tooth. We have to find a matrix system capable of doing that, and that's a huge challenge. I think that it would be a situation where I might pull out the BioClear system.
I'm probably gonna pronounce this word wrong, but I'll try. How do you handle hem control with wedge placement?
Oh,
they're talking about bleeding in that situation. Yeah. So that's a tricky situation. Anytime you're dealing with bleeding in dentistry, it's always tricky. Sometimes a wedge isn't going to cut it. You need viscostat, hemodent, cord, all of those things can help. I have a whole technique for managing subgingival preparations that I know I'm going to run into a lot of bleeding, and how to manage that bleeding. I would need to show you that hands-on to really explain it well. But essentially,
Great course opportunity.
yeah, well, those are situations. If you have a laser on hand, if you have, something like that, radiosurge unit, there are ways to, give yourself the best chance at success. But I find that when I just place a wedge, I don't get a lot of bleeding until I remove that wedge. Then that's when the bleeding starts. So, a little bit of anesthetic can help out as well. That's when I run into some problems, though, is when I take the wedge out. And in this situation, when I'm stacking these bands, I'm not taking the wedge out until I'm done. So that's a big plus in a way that, has saved me a lot of time and hassle.
So I don't know if you would be able to provide Dr. Corey a list of your preferred materials, because we did have a lot of questions about the materials you use, but there were unfortunately way too many.
Yeah, sure.
Yeah, we could get
Okay.
that and email that out to the attendees.
Yeah,
in the next couple
the
days.
one thing I'll say about that, though, is it's not, I don't think, I'd be more than happy to share the materials I use. I try to use the best that are on the market, and I do a lot of research when it comes to what I use and why. But it's less about what materials you use and more about how you use them. I firmly believe that, you could take an excellent dentist out there, which there are many excellent dentists out there, and they can use any matrix system, any composite, any bond, any etch, and get fantastic results because they understand the principles and they understand how to accomplish what they're trying to accomplish and get an excellent result. It may take them a little longer, and it may be, not quite as shiny as what they're used to if they're using different materials, but I think that the important thing is the technique and the application of the materials, not necessarily the materials themselves.
That's it for the questions that I had.
Awesome.
Great. Well, hey, thanks everybody who is still with us for listening in to the remainder of the questions. And Dr. Corey, really appreciate your time here this evening. For those of you still with us, again, we're going to be sending out emails with the quiz. We'll be sending out the recording of the event tomorrow. We'll also be sending out invitations to the hands-on event that I'm really excited to do here in a couple of weeks. So got some great stuff coming up. And Dr. Corey, thank you once again, sir.
Yeah, had a blast. Thank you.